So now we turn to our emerging company finalists. I believe that we only have 3. Paul, the fourth, was not able to show. Paul in the back again will be your timekeeper. He'll give you the 1 minute signal in the red folder and all that good stuff. And these are the companies to watch. These are the up-and-comers. So first up will be Encore Vision. Now I bet I'm going to mispronounce this. Presbyopia?
It's all right. I'll explain it.
Okay, good. Thank you, Darlene. The lost ability to focus the eye on nearby objects, such as reading a newspaper, affects 90% of individuals over the age of 40. Is this why we're cheaters? Is this part of it? Okay. Encore is developing the world's first treatment of presbyopia through the use of an ophthalmic solution in a conventional eye drop. The company's CEO, Bill Burns, is not able to be with us today. However, he has asked past Tech Titan judge Darlene to present on his behalf. I've got to tell you, I've known this lady now for a number of years. I met her first when I was working in Dallas. I think she came out of County Dad's firm down in Grand Prairie, as I recall. And she's had a great run, really spurring the entrepreneurial community over in Fort Worth. She's the executive director of Fort Worth. Please welcome Darlene Ryan.
Thanks, Bill. So yes, some of the presentations that you're going to hear from me and from the next 2 presenters are going to be a little different from these. We don't have thousands of employees. We don't have more than 1 location. We're going to be a lot smaller. But these are the companies that we hope you'll see as the ones that are up and coming, have some new ideas, and hope to someday be big and sit on that side of the table. So yes, as Bill said, I'm the executive director of Tech Fort Worth, which is a technology business incubator in Fort Worth. And because these companies don't have thousands of employees, it's also when they've got something going on, they're all in one place. And today for Encore Vision, it's somewhere else. So I'm taking this place today. So it's presbyopia. And so looking around this audience, my guess is that most of you are needing longer arms. And if not, some of the younger members of the crowd, trust me, you soon will. It happens as a natural result of aging, and the alternative to aging isn't good, so you hope that it's a problem that you will have. And to date, as you likely know, the only solution is these, right? Or contact lenses if you can struggle with monovision lenses for a little while. And we try to trick our eyes into doing better for a while, but there is no cure for presbyopia. There is only the attempt to work around it with our glasses or reading bigger print or whatever we have to do. So it does affect almost everybody by the age of 50. And for most people, it starts right around the age of 30 or just after 30 years old. And let's see if I go to the next one. So here's what Encore Vision is working on. They have it's an eye drop, and it is intended to soften the lens. What causes presbyopia is your lens hardening. It's a very natural process of aging. Some of you, I don't know, my skin gets a little drier. Other things happen as we age, right? In the case of the eye, the lens hardens over time. And so what they're working on is, it is an eye drop. I can tell you that it works in rabbits. And yes, I asked that question too. I know you all have. How can you tell? Can they read better now? Trust me, they assure me they have ways of figuring out, but they're testing to see whether they can soften the lenses. Yeah, we haven't found any rabbits that can read yet. So anyway, what it is actually the active ingredient in the product, in the eye drop, is a naturally occurring substance in our bodies. They have just found a way to use that to trick the lens into softening. And so now the trick is, and I know that a lot of people in this audience are more IT oriented, probably understood these four people a lot better than I did. But in the pharmaceutical world, it takes a long time to get a product to market, as you would hope. They have to go through a lot of testing to make sure it's safe and to make sure it actually will do what they say, all of those things. So they're in that process. So you can't run to the drugstore and buy this yet, I'm sorry. So it is an active ingredient that occurs naturally in the body. So they will have no trouble at all with the FDA proving that it is safe. It actually is something that already exists. They are, at this point, their research, they've proved the concept, meaning they've done whatever they've done to prove it works in rabbits and other creatures, and are just at this stage, as it says, they have had some favorable meetings with the FDA, so they're just getting ready to begin the human trials. As you might hope, you have to first convince the FDA that you won't hurt anybody when you try that out. So their manufacturing is in place, meaning they at least to manufacture enough to do the human clinical trials and then to move forward. And they're just getting ready to do their human studies. So the development goals, what they're shooting for here is to have these, there'll be prescription eye drops. It will take, they hope to have drops that you would put in your eye a couple times a day perhaps for 30 days, and by then presumably your lens softens. This is the goal. I'm hoping, I'm very hopeful myself. I would love to get rid of these. And that of course it will be comfortable and safe. It won't be something that causes your eyes to be red or anything like that. So their goal is that then someone at the end of those 30 days would no longer need readers or bifocals. It's a one-time treatment, so once your lenses soften, you're good to go. So it's not like something you have to take for the rest of your life. So this is the first ever treatment for presbyopia. It's obviously a multi-billion-dollar opportunity. I suspect a whole lot of us would be interested customers. And their patent portfolio is good. They're in good shape. And they do have a very highly experienced team. As you might expect, being in this part of the country, and we're in Fort Worth, part of their team comes from Alcon. This part of the country, and there are a lot of Alcon former executives out there doing new things, and this is one of them that they are doing. And they are located at they have a laboratory at the UNT Health Science Center where they're working with faculty researchers there, and they have an office with us at Tech Fort Worth. Thank you very much.